Hey everyone, Puneet here. Welcome to episode 3 of the North of Patient podcast, Conversations on Health Beyond Care. This week's guest is Teri Price. Teri is a fierce advocate for change in the Canadian healthcare system, resulting from a very unfortunate personal story. Teri's brother Greg died in 2012 at the age of 31 from complications relating to testicular cancer. Because of the many delays and information falling through the cracks in the referral and workup process, it was more than 400 days between Greg noticing the lump and being diagnosed with testicular cancer. More than 10 years out, Teri and her father have been advocating for awareness and change that is needed to avoid preventable harm to patients. Teri is currently the executive director of Greg's Wings Projects, a not-for-profit organization created to honor her brother. The first project developed by Greg's Wings was actually a movie, Falling Through the Cracks, Greg's Story, which Teri and her father have held more than 600 screenings for, and have brought it in front of a range of audiences, from clinical students to system leaders to public organizations. I've had the fortune of knowing Teri for many years. We both have been guest speakers of a lecture series at the University of Toronto's Medical School for quite a while now, where the film is shared and we highlight these breaks in the health system. And we try to get medical students to troubleshoot on how we can create change, both on a personal and individual level, and of course, a professional and system level. On more of a personal note, I'm also reading a fascinating book that I wanted to share, Deep Utopia by Nick Bostrom, University of Oxford professor of philosophy and the founding director of the Future of Humanity Institute. The book explores a topic that I'm very interested in and that's very much aligned with this podcast. As machine intelligence rises and we wrestle with the idea of reducing demand for human labor and thought, what do people do all day? What does a solved world look like? Could there even be such a thing? When I think about the degree of basic challenges that we're facing in the healthcare system right now, which go all the way down to referrals and communication, as I discussed with Teri, the ideas in this book seem almost absurd. But at the same time, it's important for us to not let ourselves be isolated in only thinking about our problems as they exist today. Or we could find ourselves blindsided and unprepared for absurd possibilities tomorrow. I'll keep you guys updated in the coming weeks on my thoughts about the book. But for now, let's get on to the conversation with Teri Price. Thanks so much for coming on to the show here today. I'm super excited to chat. I know there's actually lots to discuss when we talk specifically about, the role of the patient and the perspective of how people see the healthcare system and how people see the future. But maybe as a starting point, can you tell me a little bit about Greg's Wings and what it's trying to accomplish?
Yeah, so Greg's Wings is a small not-for-profit that we created in honor of my brother, Greg. And the first sort of major project that we took on as an organization was the production of a short film that's called Falling Through the Cracks, Greg's Story, which we use. It's a 30-minute film that we use with lots of different audiences. The original trigger for creating the film was for it to be used in medical school. And we were excited about the potential to have an impact on the next generation of doctors. But because of the quality of film that we managed to pull off, there's been lots of interest beyond sort of medical school. And we've been really grateful for, I guess it's been 6 years that we've had the film to be able to share the film with more than 600 audiences. And the combination of Dad and I typically will, the vast majority, there's only been a handful of screenings that we haven't joined to be able to be part of the discussion after the film, because we've learned that the discussion is really important. And we have learned a lot from those discussions and continue to learn more about the healthcare system and what patients are experiencing, what the workforce is experiencing, and we take that into a bunch of the other work that we do that runs along in parallel, either directly with Greg's Wings and the things we want to focus on, or both Dad and I sit on a number of different committees and boards and stuff. And so we bring what we learned through the use of the film into the other work that we do as well.
Yeah, and that's actually how you and I first connected, and your father as well, which was actually through, I believe, a screening during medical school for University of Toronto students. And that was how many years ago? I think maybe
Yeah.
4 or 5 years ago.
Yeah. Yeah.
Um,
It would have been just about the right timing.
yeah, and that was part of the patient safety and system design part of the curriculum. Because students were going from medical school to, or from pre-clerkship to clerkship, and as part of their training. I, of course, have seen the video a number of times. As you and I have talked about before, it's always deeply touching and impactful, which is why I think it's so important for you to be doing the work that yourself and your father have been doing now. which is really getting that message out and humanizing those breaks in the system, because it's one thing to talk about numbers and cracks in the system, so forth, and it's one thing to make it real. And I appreciate it's a big sacrifice on your part in many ways. How long has this been going on for now? The initiative.
Yeah, so we filmed the film in the end of August of 2017, and then had this sort of bigger public launch of the film in 2018. And started sharing it with, well, the University of Calgary Medical School pretty much right away, because that was the connection that we had at the time. And then spread right away. So that was, I think we did the very first screening with medical students on Halloween of 2017. And then it spread into Toronto, has been a great partner, and it's been fully embedded into the undergrad medical school there. Probably happened. We probably met with Toronto in the spring of 2018. Yeah, so it's 6 years of fully using it, and yes, more than 600 screenings. Um, and just a lot of learning, and so much. I'm so grateful to have the film, because I think bringing patient stories into education broadly, medical school included, is a powerful way to sort of to make that the real connection with the patient experience. And I think the film also sheds light on the position that we're putting the workforce in as well. And so the story can open up the door for discussions that is challenging to do it with any other sort of tools or tactics. It's a half an hour film that opens the door for some discussions that are really important, and I think have been impactful, and have been an amazing way for us to be able to advocate for change and sort of continue Greg's legacy, um, through the use of the film. And I'm just so happy that we can sort of join a session or walk into a room and hit play and have the film tell the story, rather than having to try and explain it every single time. I think we would have burnt out and stopped well before 600 screenings. But because we have the film, we're able to continue those conversations and continue to learn alongside the film.
And actually, also for listeners, I'll note that we'll put the link to the website and the information associated. And I believe, do people have to sign up to be able to watch the video, or is it how does that work?
Yeah. Yeah, so right now it's partially because we've recognized how important it is to have the discussion. The film, it's the dramatization of a real story. We know some of the reaction to the film can be quite emotional, and especially for people who have gone through their own experience in the healthcare system, in some ways it can be triggering. And so we had decided that we wanted to be able to make sure that there's some kind of discussion or debrief as part of the sessions. And so we host monthly public screenings where we take a Q&A after the film and sort of talk through some of what we've learned and hear reactions from the audience as part of those sessions. But we haven't posted it where you can just like Google it and watch it on YouTube independently at this point. We are starting to explore how to set it up so that you could still have some kind of interactive learning alongside the film. But we haven't got to the point where we're ready to launch that yet, but it's on the list.
Reflecting on the experience of being on the teaching side, I think about the role that these impactful stories have on students as they're going through training. Especially as we begin to think about the future of where healthcare is going and the changing role that healthcare providers will have in that journey. I think how much more important it is to ground people back to that original reason that brings people to want to go into healthcare delivery to begin with, which is often that either a personal conviction, a lived experience, or through this general desire to want to be able to help people in times of need. And in order to be able to maintain and cultivate that, perhaps we actually need more storytelling as we look into the future. What are your thoughts on that?
Yeah, for sure. And I think and we've seen examples, there's examples across the country where that sort of patient partnership and bringing the patient into the classroom and being able to share and mentor and be part of educating the next generation of the workforce, not just doctors. But I think that's incredibly important, because if I think that ability to learn from different perspectives is so valuable. And Greg's story is one story. And we're so grateful we have a way to tell it that's impactful. But we do try and encourage people to seek out other stories and love to be able to love learning more about how different schools are partnering with patients and bringing them into sort of small group work and being able to enable more presentations and enable the um, students to be able to reach out and ask questions to patients, because I think it's just a different kind of learning, and I think it can be really valuable for patients and families to be able to share their perspective and potentially feel like they're contributing to a better future for the healthcare system by interacting with the next generation as well. That can be really rewarding for people.
Yeah. Um, what do you feel has been the biggest success of the initiative? Perhaps either expected or unexpected. Now, this has been going on now for 7 years plus. Yeah.
Yeah, we haven't like intentionally tried to track. It's partially just the capacity and the size of the organization, really track the direct impacts that the film has had. But we continue to build this network of people that are trying to spark some change and think about the future of the healthcare system. And I think that network it's really valuable for us. But I think if we can support the people who in many cases have been working for years to try and implement change, that if we can help support and help speed some of that up, that's really valuable. I think I remember it was probably actually the first day of shooting the film. I sort of had it in my head that we would have this 30-minute film that Ward Flemons, who was the physician that we knew that was faculty at the University of Calgary, that Ward could use, and we would spark some change with the medical students at the University of Calgary. And then after the first day of shooting, the crew was just showing me, and it wasn't even video footage, it was just stills of what we had captured that day. And I recognized that the quality of the film was going to potentially open doors to go beyond just the University of Calgary Medical School. And we had fully thought that we would do a bit of a tour with the film and then put it up online and just maybe try and interact a little bit with it. And it would be 6 months or a year of being directly involved in the use of the film. And now it's 6 years later, and we're still like participating in every single screening of the film. So that was definitely unexpected. And also the spread, like really the trigger for creating the film was for medical students. But because of the way the script was written and the way the story is told, it's not really about doctors. And so it's being used with current healthcare professionals and interdisciplinary education and all of those things that we hadn't really thought of, but I think are really important and impactful. And then it's led us to be involved in a number of other initiatives that I never would have thought of
Yeah.
at the time that we were creating the film.
And has it led you outside of Canada as well? Have there been screenings and work at that?
Yeah, in the first sort of probably year to 18 months, we did a screening at two different international conferences, one in Malaysia and one in Switzerland. And so we're able to sort of interact those because it was very international audiences and participants in those sessions. And so it was interesting to hear the reactions from people in other countries. And we did one in the US that had that audience was probably majority Canada, US. And I was really curious to see whether or not the US would just sort of dismiss this as being a Canadian story, Canadian issue. And I think a lot of the fundamental, like sort of culture of medicine, the historic kind of stuff, it resonates across the board. There is lots of differences in the system, but there's some fundamental things that are a challenge for any healthcare system, I think.
Yeah, that was going to be my next question, which is, have you come across an audience, a country, health system where that's just not how our system works? Has that happened?
Not completely across the board. I think there's probably some things that they see in the film that wouldn't happen in other countries or other parts of the system, but there are so many layers to it that it doesn't get completely dismissed because there's some aspect of it that's relevant. I wish we could say we just have to show the film for whatever 6 years and then we would have all the problems solved. That's not. It's going to take a while before the film becomes irrelevant because some of the issues that are in the film are complicated, and it's not an easy switch, and it's going to sort of take a generation of the system changing in order to actually get to a point where it's a completely different experience across the board.
And I'd like to come back to that particular point around what's changed. But before we go there, was there something that you felt like you learned or you took away from a particular health system or something that an organization somewhere was doing was very memorable in terms of, wow, I wish we could bring that thing back and benefit our system here in Canada?
Yeah, I think there's always pockets, right? Like there is lots of different and new and interesting, innovative things happening. And even just it's interesting to learn from people who have lived or worked in two different places too, and to be able to compare and contrast and sort of I remember there's being a couple of examples where they were referencing different health systems in Europe around teamwork being more normal and the ability to work together and share information and some of that stuff being less of an issue in their day-to-day experience. But then coming to Canada, there's some of the specialties and the specialization and the advancements in care delivery that we have here that somebody in one of the audiences actually said that if they had a sort of uncomplicated normal diagnosis, they would rather be in one of the European systems. I think it was the Netherlands, because the teamwork and that aspect of it was stronger, that the experience for that would be better. But if it was a complicated diagnosis or
Mm,
something that was rare, the skills and the knowledge and the technology and stuff in the system that he was experiencing here, he would prefer to be here. And so
interesting.
I think,
Yeah.
yeah. And so it's come up a couple of times where there's little examples, and even within the country, there's examples of pockets of stuff that are just like, oh, that is a really good approach. Why are we not doing that? Why hasn't that spread better? Because there is lots of opportunity, but it is a complicated system that we have to be able to have that local context recognized and built in. Uh, but there's a lot to learn, and I mean, even thinking about the future, there'll be places that adopt and advance technology, the use of technology faster than other places, and have just the infrastructure to start with, and even just the culture around it to start with, maybe better than other places. And that was actually one of the things that we wanted as a family fairly early on, was to like, is there ways that we can help to spread and share some of these ideas and things that are working, and what is it that we want to emphasize, and focus on, like sort of what our priorities are for the change that we want to see in the future of the healthcare system, because we are in a fairly unique position where we're interacting with lots of different parts of the system, different parts of systems in the country and different countries, and people that have experience from different um, aspects of the system as well. And so, how do we try and figure out how to share some of that learning? Because people do, for a number of different reasons, get very focused on their own piece of the puzzle
Mm,
without necessarily having that system wide view. Um, yeah, that could be better
slightly.
for sure.
Is there a specific example of something like that that you've brought back or put forward to one of the provinces or one of the organizations? Can you think of something?
Um, on the teamwork side, we really try and emphasize building teams around the unique needs of patients, and I think there was examples. I think it's the cancer system in the NHS that automatically stands up a team when there's a diagnosis of cancer. Like even something, and that's I mean that doesn't necessarily, it's not the like cutting edge innovative use of technology, but it can be really beneficial across the board to have that sort of trigger for enabling teamwork, because we really do believe that we need to have stronger teamwork in healthcare. There's also, I mean, there's lots of interesting technologies that are being used, that we're excited to see. And I mean, the ambient scribes and a bunch of that stuff, we hear examples of and hear from physicians who are excited to be able to sort of sit across and face their patients and have a conversation that feels
Mhm.
like it's a real conversation, and know that it's not that they have to remember everything that was
Yeah.
said and spend hours typing things in. We do try and focus a bit more on the technology side, on it being an enabler for the kind of care and the kind of systems that we want to see. And so looking for the technology that's enabling that is always a focus for us as well.
Mhm. So, needless to say, you're on the side of believing in the role and utility of ambient scribes. Is that a fair assessment?
I mean, I'm not somebody that has a huge depth of that's one of that's one of the things that with the film we get to meet and scratch the surface on a number of different things. I do not present myself as being an expert in any of these things, but I can definitely see how from a patient perspective, from the physician perspective, from being able to capture the important information that could absolutely be something that we want to that can make a difference in the future. I've experienced it where the physician is sitting typing on the computer as I'm talking through symptoms and how I'm feeling and some of that stuff, and it's kind of feels like a necessary evil to be staring at a computer. And I think there is an opportunity to really how do we build on people's strengths and set them up for success in doing the kinds of jobs that they want to do. I mean, lots of people get into healthcare because they want to care for patients. They want to provide that sort of careful and kind care, but there's so many things that can distract from that. But I think there's an opportunity to refocus and shift back to enabling and setting people up for success in delivering that kind of care.
Yeah, and on that note on ambient scribes, and as a physician myself, and I've been using ambient scribes now since they've more or less been in the market for well over 8, 10 months. And 100%, I think that it is a move in the exact direction we want to go in, which is that what's really left is the clinician, the care team, and the patient, not all the other stuff. And I think what's particularly intriguing about that, especially as it interacts with Greg's wings, is the idea that the ambient scribe is it's really AI taking a first step into the clinical interaction. So yes, the documentation automation is a fantastic piece, but then it also means that the things that it's saying need to happen, the follow up, the ordering of the test, the information that needs to be sent, all those things. There's an opportunity to convert that language to something the patient can understand. Obviously, make that available to the patient so they're not kind of like, well, what did they say? Or did they say it was
Yeah.
my job or their job or what? But then also to make sure those things happen. And when they don't happen, to begin to again be looking through the chart at all times and making sure that nothing's falling through this. So I do think ambient scribe holds that promise. Obviously, we're not yet at the point of maturity where all those other pieces happen, and that would require that depth of interfacing with the system. But I'm optimistic that might be one of the more meaningful enhancements from a safety perspective for sure.
Yeah, for sure.
Let's do a little bit of a thought experiment looking into the future. And I think this is an important part of what I'm trying to accomplish here in North the Patient, which is looking into future possibilities and kind of teasing out what's good and not so great about it. But uh, let's imagine a not so distant time in the future, 3 to 5 years from now. Maturity of artificial intelligence has taken place. It's everywhere in society and in different industries. In healthcare, it's playing a bigger role with clinical decision making, a lot of the data crunching, the presentation of that information. And so a lot of that's changed. Can you tell me what what do you think about that? About the fact that machines, artificial intelligence will be playing a likely greater and greater role with the actual clinical thinking, the clinical decision making, obviously initially in conjunction with clinicians, but obviously over the arc of time, probably with more autonomy and lower risk situations. So what do you think about that and what might good look like in that situation?
Yeah, and I think it expands on what we were just talking about with the ambient scribe as an example. But it's really like focusing on what we want the healthcare system to look like in the future and enabling technology to fill some of the gaps that currently exist and try and improve the actual experience from the sort of whole care team perspective. I think there's a lot of things that make sense for technology to at least enable, if not replace, the hesitation on some of those things. I mean, and we quite often will talk, safety is an incredibly significant focus of what we want to see in the future of the healthcare system. I mean, when we were learning what happened with Greg, we were shocked at we made assumptions about what safety would look like in healthcare. And we're shocked at the culture and the lack of real safety infrastructure and organizations and some of those things. And we quite often, I mean, one of the reasons why we advocate for teamwork in healthcare is because having strong teams should lead to safer care for patients. Because it's not, I don't think care can be delivered, especially if there's a significant diagnosis or it's a complex patient. It can't be delivered by an individual. We need a team. And so, how do we make sure that we enable and create the conditions for effective teamwork? And I think there's a huge opportunity for technology there and artificial intelligence attached to that, and machine, all of it.
Yeah.
Because I think some of those things that make teamwork really hard right now can potentially be met through the use of digital tools and technology that's coming, that it's kind of both interesting and in some ways a little bit scary. Because if you think from a safety lens, how do we make sure that the tools that we're using are safe and are using the kind of, I mean, if they're learning from data sets, what's in the data sets, like all of that conversation around making sure that the tools that are developed that are actually using information that's going to be able to help the populations and doing what's intended, instead of learning off of things that lead to inequities in care or poor decisions or all of those things. But I think, I mean, if you think of from a safety perspective, even if it's another layer that can that can be a guide, that can be part of and potentially speeding up, because that's the other aspect of it I think we may see, is that the shrinking of time that it takes to do some things, because so much manual process is built into the system right now that leads to time being used, and how incredibly important and critical it is for patients to have, and the entire care team. But the waiting is both from an experience and stress, and also the impact on outcomes. Time is definitely a factor there, and if we can shrink that time by automating some of those steps, that's definitely a benefit. So I think, and sort of setting people up for success, enabling the kind of system that we want to see. So even thinking about where the role for technology and will be beyond just like my, instead of interacting with my doctor, I'm interacting with a machine. Like, I think that will actually be fairly small part of the overall opportunity for technology and healthcare. Because if you think of all the systemic issues and the challenges and hurdles and the process and the wasted time and all of that, that there's a huge opportunity for technology to play a role, but we have to make sure that it's safe.
Yeah. All the things happening in the background, is where things can happen with automation, and as opposed to that interaction between patient, care team, and the patient. But on that spectrum of level of comfort with, automation of even that clinical decision making interaction part, because a lot of times right now there are solutions that are kind of coming out that are much more autonomous in the sense of no human involved. It's a prescription renewal and something basic to start. Hey, maybe it's just a mild rash. Where do you fall in that spectrum of comfort and belief that it's okay for some of those things to perhaps be made available to patients without necessarily having a human being there?
Yeah, I don't know. I would need to know more. And that's another thing that I think is going to be critically important for the future, is that sort of building the transparency and trust into what is being implemented. So, is there a way to fully understand and see, like, if we're expecting everybody to just have blind trust in the tools that are chosen by whatever, a small number of decision makers, and that we just have to trust that they're going to do the right thing, then I think there's definitely some risk there. But if we're saying that there's a fairly high bar, a standard that has to be met, we're confident that that leads to a level of safety that is that we're as a population or the people using the tools are comfortable with, and then being able to build on that and be able to take advantage of some of the potential innovation, the innovative ideas and companies and people that to build on some of that foundation that should actually get us to a place where we have a healthcare system that we're excited to have and to be a part of. Because I think a lot of that, there is a lot of that blind trust even in the system now. We trusted and made a lot of assumptions about the healthcare system without really fully understanding. We assumed that technology was already being adopted at sort of the same speed of the other industries that we have more experience in. And we're a bit shocked to sort of learn that, I mean, the system, and it's still true 10 years in, the system relies heavily on fax machines, that when you're trying to work together as a team, one of the mechanisms is to write a letter and fax it off to the next person. Like some of that stuff, I think we need to be able to take that step back, try and dream up what we want to see from the future of our healthcare system, create a solid foundation, and then enable that building and those progressive steps towards the future healthcare system that we want to see. Versus, I think a lot is very reactive in healthcare.
Of course.
And so I think we need to shift the approach around change, in order to get where we want to go.
Um, what would you say is something that healthcare decision makers, the healthcare system gets wrong about the patient? You've obviously been in a number of conversations with decision makers. What do you hear sometimes that you feel is not aligned from the perspective of the patient?
Um, I think one thing that we try and be careful on a lot of the time is the us versus them patients being seen as being outside of the system, outside of an organization. And I think we need to shift that perspective into we're sort of in this together. It's sort of being on the team, and that patients have um that patient voice isn't a box to check that you've included somebody on a committee. We need to include patient voice on a committee, but it's not the only thing, and that it's not, I think, and because my background's actually in disaster and emergency management, and I remember at the beginning of the pandemic recognizing some of the organizations where their patient partners that were advising them on a number of different things and strategy and fully involved in decision making in the organization before the pandemic were still included in those incident command teams. And to me, that's a very strong signal that they actually see the patients as being a member of the team, that they see them as a partner. They recognize the contribution across the board that patients can make. And I think that is a sign of strong leadership versus it being something that as soon as the pandemic hit, everybody's in a state of emergency. Patients will deal with you when we come out of this, like the patient partner or patient engagement or whichever label you want to put on it. I think we still have quite a ways to go.
Yeah. So basically, patients are still effectively considered outside of the core care team.
Yeah, I mean, there's examples, but we're not there yet. there's good examples, but they're still probably in the minority.
Are you hopeful about the future? About where things
Yeah, I think, yeah. Yes, I think we would have given up on some of this a long time ago. We do meet lots of people, and it's more that we're grateful for a lot of the people that we meet in the system, and that makes us hopeful, or the conversations we have with students and the questions we get from students, and that seeing that shift, or seeing and being able to interact with different startup companies and the innovations and the problems that they're trying to solve. All of that makes us optimistic. And there's momentum behind some of the things that we see as being priorities. We sort of have three loose priorities that we decided as an organization fairly early on. One is teamwork, which I've brought up a couple of times. Access to information is another one. And those are, I mean, all three of these are tightly linked, but those two are specifically linked because we don't believe you can actually work effectively as a patient's care team if you can't share information or communicate. It's part of being able to be a high performing team. So that access to information is critical, and we're seeing some more momentum around that now. And the third priority is around sort of healing after harm, or learning when things go wrong, and really trying to have the health system be be a learning health system that enables the kind of just culture and enables people to speak up and see that that's part of their responsibility and their role is to help make a safer healthcare system. And I don't think we would be at this point where we're able to talk about what we want to see in the future and have an understanding of what happened if we didn't have the opportunity to learn alongside the Health Quality Council of Alberta, who did an investigation into Greg's death pretty early on. And so that's another, but that investigation is extremely unique, and we don't believe it should be. So that's another priority.
When you think about a future in which there's a greater role of technology in the context of the interaction between patient and the system, what would be a bad outcome? What would a bad outcome look like?
Um, I mean, there's always that risk that there's some bias built in and the inequities in being able to either deploy the technology or the decisions that are being made in the technology. But that to me is a safety issue. And so if we're not actually thinking through the potential risk to safety to the system, and creating the conditions for safety needs to be considered with any change in the system, including the deployment of technology. So I think anything that increases that potential risk is definitely obviously a bad outcome. Um, but I think that as long as we intentionally are planning for it, intentionally thinking about those risk factors, that it's not something that can't be overcome,
Yeah.
and then it's that element of transparency that can build trust, so that people are actually comfortable and excited about the use of the tools versus it being sort of the "don't worry, we've got it." We definitely need to build in the opportunity to ask questions and learn and make sure that transparency leads to the building of trust.
And kind of building on that, do you feel like the roles of healthcare providers as they're defined today, um, do you think that they fit with where things are going into the future? Or do you feel
I
like there's probably room for reevaluating that? This is what a nurse is supposed to do. This is what a doctor is supposed to do. This is what a pharmacist is supposed to do. And to what extent do you think that is important, that structure? And to what extent do you think there's a need for realignment as we look in the future?
Yeah, I think we need to be ready to see what emerges and to be able to adapt to what emerges and for new roles to pop up and to be part of the care team. I think anytime that we talk about it, and this is relevant for the conversation around professional boundaries, but I think anytime that we're super rigid in some of those things, that like beyond just setting a level of standards and moving sort of more into that stay in your lane, that's not your job, that's my job kind of approach and culture, I think that that is something that we want to get rid of in the system. But also at the same time, when we're talking about teamwork, understanding the role that everybody has to play, what they can bring to the table, setting them up for success in being able to contribute the knowledge and the skills that all of those professions bring to the table or bring to the team,
Mhm.
that is really important as well. And so I think it's more understanding those strengths and trying to enable the strengths and thinking about the skills and knowledge that the different professions bring versus putting them and enabling them to be high performing, contributing to high performing teams versus putting them into a box saying you're allowed to do this, you can check this list, and
Yeah.
that's your role. I think we need to move away from the rigid boxes into that sort of how do we maximize the skills and knowledge that you have, and whether or not it's because of your training, which may have been 25 years ago, versus the skills and knowledge that you've built over time.
Yeah. At the end of the day, it's all about serving the patient and providing the best possible outcome to the patient. And I think in order to be able to accomplish that, you need to do the best that is possible in that given situation. And it's a complicated thing because I think there's obviously there's a lot of legacy. There's a lot of I think existing infrastructure that's built around that. And I do think that that impedes progress because it puts everyone's backs against the wall as opposed to kind of saying, okay, who are we trying to serve? And where can each of us best bring value in order to maximize our ability to, to serve? And how about the idea of the changing role of the patient and how the patient benefits through interactions with the healthcare system? And as an example, there's a lot of talk about data, obviously, and increasing data sets. And there's varying models coming out regarding people being able to be compensated for sharing their data. So it might be okay. Well, it could be direct financial compensation. It could be, hey, you're going to this grocery store or supermarket, and if you enroll in X, Y, or Z program, maybe you get a discount on muffins or something. But to what extent do you think it's ethical or appropriate for patients to be able to benefit from their data that they voluntarily sharing?
Yeah, and I mean, it's a super interesting conversation to think through all of those potential scenarios and to try and think through, okay, well, what is the most likely path that we're on? And also it's another area where I probably make assumptions and that there's things happening that I'm just completely unaware of. I'm a bit sensitive to the language around standards versus standardization.
Yeah.
And so thinking that all patients are going to agree with how their data is and be comfortable, everybody's going to be comfortable with the same approach, but that's just not going to be the reality. There'll be some people that have no problem completely opening the door and sharing everything, whether it's because they just don't really care or whether they see it as being sort of an altruistic, I'm contributing my data because it's for the better good and better understanding of population health or enabling innovation in the system. People have all kinds of different motivations, but I think we need to have the standards around sort of that baseline that or those lines that we're not going to cross, and then enable some experimentation and curiosity and trying different things and hopefully engaging with the people that it impacts in a meaningful way so that they can actually be part of those discussions instead of decisions being made about them without anybody being part of that discussion. Because I don't think there's going to be a single right approach, but enabling some level of choice. And for me, like the use of data, if somebody's making a ton of money off of my data, then it's different than if there's been public good. Like
Yeah.
there's lots of even in that conversation, there's lots of different elements that we need to have open discussions about.
Yeah. I totally agree. I mean, I think it's obviously it's a big area. In general, I'm belief of the idea that obviously we need greater patient control to be able to to share data. But if I was to give a specific example, let's say I have asthma. I end up taking medications for asthma, and companies developing a new device for that, and they need my data associated with my oxygen levels or my breathing or activity or whatever else, and they're going to benefit off that. I do think that there's a case to be made that the, the patient should be one of the benefactors of that, as opposed to be left to being like you're advancing asthma. If it's an altruistic cause for you, but for us as a business, right? That being said, again, if the entity is, let's say, a public institution and publicly funded research, program that's trying to help develop new molecules, whatever the case may be, I think there needs to be that discrepancy between the intent of the organization, where those funds are flowing from, and the need to be able to have the patient be aware.
Yeah, for sure. I'm working through a bit of a course on integrated health systems. And one of the conversations we had, somebody was talking about how right now, in a lot of places, and this was an international perspective, but in a lot of places, data flows up and the benefit. And so the purpose is to send the data and that information into sort of top levels of the healthcare system versus it being a horizontal purpose and benefit. And so is there a way that we can shift so that that people understand the purpose of the use of the data and get some of the benefit, whether it's financial or other. Maybe it's that they recognize that there's better treatment on it, options, which has a huge value as well. Um, but that how do we enable so that the benefits of sharing data and capturing data and the analysis of data isn't only into the top parts of the system, that it actually that benefit is, and what we're capturing is intentionally meant to benefit the sort of across the board in the system versus it just being so that it's reporting into boards or leadership or whatever.
Yep. Are there any other topics you want to cover? Any questions or points you wanted to make or add?
Yeah, I don't know. I think when I was trying to sort of think through how this conversation might go, I think the need for a bit of shift around change in healthcare, I think we need to make sure that is sort of a skill set that our workforce and across the board, the understanding of change in healthcare, um, because so much right now is reactive. And I think we need to be thinking about what we want to see in the future of our healthcare system and then be ready to be part of that change. Whereas now, I think, especially more now than 10 years ago when we first started, sort of after Greg died, and we were starting to have conversations about change in healthcare, um, there was less, there was more defending the status quo than there is now. I think there's a recognition that people, and a lot of people that want things to be different, but don't necessarily, but also react potentially in a negative way a lot of time to change. And so, how do we actually have those that be built into the future of our healthcare system is that skill set and mindset and recognition that there's going to be constant change. How do we actually have that strong foundation and be able to be making progress towards a future healthcare system that we want to see versus it being a lot of that feeling that change is being dumped on people. They don't understand
Yeah.
why these decisions are being made. They weren't um, consulted in a way that meant was meaningful for them. And this is across the board. This is citizens. This is the workforce. There's so much that needs to shift around the culture of change in healthcare because I think it's um, something that it's going to be probably happening more rapidly than it has in the past, hopefully. But we also need to it has to be something that we're comfortable with the path that we're on.
And actually, on that note, what else? What do you feel like needs to change in medical education? Having been somebody who's been peering into the curriculum across the board in different places, different countries, what are you seeing as a pattern that you feel like, what, this needs to change in order for there to be progress?
Yeah, I think yeah, to sort of build on, I mean, having that mindset that things are going to be constantly changing and that need to be able to adapt,
Mhm.
and that they can try that the learners now can be thinking about the future that they want to see in the healthcare system and contribute to that they can be part of that change, I think is really important. It's a message we try and reinforce, but I'm not sure if that's built in other aspects of the curriculum all the time, or at least historically.
Mhm.
And so, like, you say one thing in the classroom, and then they sort of get faced with the reality of the current healthcare system, and it can be frustrating to try and think about and make the link between where we're at now and how we can get to that future healthcare system that they want it, that the next generation wants to be a part of or wants to work in. Um, I think we also to really try and reinforce the teamwork message and that mindset around the like using physicians as an example, but it's not just physicians that they're play an incredibly important role in the patient's care team, but that they have to be able to work effectively as a team and recognize some of the other um, members of the team that can be incredibly valuable for patients and families as well, and really treating patients and families as members of their care team and all of the sort of teamwork principles that apply to high performing teams that is relevant for patients and families as well. And yeah, so and the anticipation um, and trying to think about the future versus just reacting. And that is relevant for patient care sort of at the bedside, but also at a system level as
Yep.
well. Being able, and so that systems thinking, I guess, would be another element, that being able to zoom in and recognize the role that you have on a patient's care team, but also be able to zoom out and see the bigger picture of the healthcare system and how you can contribute to a system that we want to see, um, at the same time. So building that into the skill set that people have, because I think some of those things that may be seen as sort of the softer skills, historically, may become, I actually think they're going to be more relevant in the future
Yep.
than they necessarily have been in the past or up until this point.
Yep. And so to paraphrase, I guess what I'm hearing is greater degree of adaptability, preparation for change, greater inclusion of the patient in the as part of the care team, as part of the care process, and greater focus on teamwork. So,
Mhm.
yeah.
Yeah, for sure.
And yeah, I entirely agree with you in terms of the soft skills piece. I think that's, I'm reflecting on my medical training. I trained at McMaster University, and I remember there was a component of the curriculum that was called behavioral science and professional competencies. So, acronyms were BS and PC. And as an early person in training, it really did feel like those were kind of like the this isn't important. Let's get to the real medicine. And you often wondered why they were there. But as I've gotten further and further from training, and I've looked back, I've really felt like, wow, okay, I understand the utility for spending the time focusing on kind of reflection, focusing on empathy development, on kind of talking about good examples, bad examples, sharing real cases and scenarios that people kind of dissecting those, taking the time to look at videos of interactions you've had and have third parties look at that and say, well, let's what could have been a little bit better? What did you do great? What did you not do great? And while all that seems kind of like mushy and perhaps less relevant than, the kind of the classic medical component of it, I think the reality is a lot of that deep thinking is going to be, outsourced greatly. And obviously humans will be verifying those decisions and making sure all the information going in is appropriate and the things coming out make sense to the person and everything is safe. But I do think that there'll be more time to focus on actually being human and being able to have that attraction.
Yeah, for sure.
Yeah.
And I think like attracting people that those are their strengths, into the system will be important in the future too. And I think we're seeing some different approaches on recruitment into both into like admissions, but also into the workforce too.
Yeah, and it always reminds me of that quote. There's an investor from Bay Area in the States who's quoted with saying, the best clinicians of the future will be trained at the UCLA School of Arts, not the Stanford School of Medicine. And
Yeah.
I do think that there's truth to the underlying point that he's trying to draw there, which is that it is going to be the skills of communication, a lot of the skills around humanities, around empathy that are going to be the distinguishing features.
Yeah, for sure.
But
Exciting.
yeah, very excited. Terry, thank you again. I appreciate the time and the opportunity to chat.
Yeah, no, thank you. It's this is an exciting conversation. I think we need to have more space and time for the discussions about change in future and all those things. It's one of the things that we love about being able to share the film and have a discussion after the film, but we're in a fairly unique position where we get to have that on a regular basis. I think we need to be creating the space for people across the board to be able to sort of take that step back and dream about what they would want to see and see if there's a path that we can collectively get on that shifts the system into a place that is better for everyone. It's safer for everyone. There's the we're addressing some of the additional needs and stuff that are starting to be recognized, but that it's not just about medicine that we can but and that we're also taking advantage of the opportunity and innovation that's happening in a responsible way.
Absolutely. Thank you again, Terry, and thank you to your dad as well.
Yeah, always. Thank you.